Hello, everyone. Welcome to the breakout session discussing how to live in urgent mode. We will give it a couple of more minutes and then we will start. Thank you for joining us. Okay, hello again, everybody. Welcome to the breakout session where we are going to discuss the current reality of our lives, which is how to live in urgent mode as a person with disability. We have quite packed agenda, so while we are still being joined by others, I would suggest that maybe we can slowly start. In terms of housekeeping, we have the international sign available, and is captioning available in the bottom of the screen? I just want to get a confirmation from my colleague Alejandro.
Yes, they are available. Yep.
Yeah, so you can see the captioning at the bottom of your screen, and the international sign is available. If you have any questions that you want to share, and I strongly encourage you to do so, please use the chat box. And then we will look at the questions and ask them. And we may also invite you to get you unmuted so that you can just join us and discuss what your question is. But for that purpose, we would first need the question to be posted in the chat box. Okay, so my name is Elham Yusufian. I'm working with International Disability Alliance as the Inclusive Humanitarian Action and Disaster Risk Reduction Advisor. Why we are here is to see, as we all would admit, there are so many emergency situations happening these days that it wouldn't be really exaggerating if I say that we are living in urgent mode. Like on one side, we have the global pandemic, which is an obvious crisis for humanity. Then we have all the news about climate change that we really need to do something about it as quickly and as efficiently as possible. And then at the same time, we are witnessing armed conflicts happening around the world. We are witnessing other disease happening. We are witnessing typhoon, cyclone, flood, earthquake, and all other situations of risk. So we are here to discuss some of these challenges and some of the steps that have already been taken to address those challenges. And then at the same time, discuss together the future steps we can take. So we have quite a bit to discuss. The session will be around three important topics. First of all, we're going to discuss about COVID-19 vaccination. If you joined the first session, the plenary session, you may have heard that we just today, the International Disability Alliance launched a small paper with 8 key recommendations how to ensure persons with disabilities access to COVID-19 vaccination, and that we will discuss together about it in a minute. Then we will talk about humanitarian inclusion of persons with disabilities in humanitarian action. And then finally, we will talk about disability inclusive climate action. So be with us, and hopefully we're going to have a fruitful conversation together. One important point about the session today is that it's not a kind of formal panel. We're going to be joined by experts on each topic, but we will really rely on the questions and contributions from your side. So we will be having a flowing conversation. So if you have any questions, comments, please feel free to post them in the chat box. And we really hope to make it as interactive as possible. So thank you again. So let's move to the first topic, which is about COVID-19 vaccination. On this topic, I'm joined by Catherine Norton from European Disability Forum. The European Disability Forum actually took the first initiative to discuss and raise their voice about the necessity to include persons with disabilities in COVID-19 vaccinations, and the fact that if we are not prioritized, we are not going to be really included. So Catherine, welcome, and tell us about that and what happened. Why did you decide to launch that? And then we worked together to make it as an international document, which was launched today. So let's hear from you. What was the background of that, and what were the concerns that made you to work on this piece?
Thank you very much, Elham, and thanks for the invitation to discuss this here with you and everyone today. It's another example of living in urgent mode, because actually we hadn't really thought about this vaccination issue too much. We had, like all of you participants and like you and Ida, we had been dealing with COVID-19 related issues as they come up on a case-by-case basis. And what we saw then, I think it was on October the 16th, the European Commission launched its vaccination strategy, and it focused very much on ensuring if vaccination would be efficient and effective, that it would be very important to have a targeted rollout plan. And they explained all the people who are the most exposed to the virus, medically, and also in their work, and that these populations should be targeted. And so we were super disappointed to see that no reference at all was given to people with disabilities or their support network, not because people with disability, this isn't conflating disability with illness. It's more what we know is right from the beginning, people with disabilities were more exposed to the virus itself because of the lack of protective equipment, the overrepresentation in institutions and closed settings, all of the measures to prevent COVID-19, many of them more difficult, like physical distancing. So we felt that in many parts of the lives of people with disabilities, there is a bigger exposure to COVID-19, and also the socioeconomic impact of COVID-19, the need to work with personal assistants, interpreters, for all of these reasons, and also because the evidence we saw that people with disabilities were more likely to catch the virus and also had higher death rates. We could see that it would be important for people with disabilities to have priority access to vaccination. Now, this is not to say obliged to be vaccinated. And of course, a really important element is informed consent, and that the vaccinations are explained very well to everyone, and that's done correctly. It's not about obligatory vaccination. It's more to have the option. So in order to be able to return to work, to return to school, to return to normal social activities, that we would like people with disabilities to be part of the first priority for COVID-19 vaccination.
Thank you, Catherine. So we have 8 key recommendations in this paper. Can you just explore them a little bit with us? Like, what are the main key things that we are asking? What exactly we are asking from, and who we are asking to take measures on that?
Okay, that's very good that you ask me, but I don't have the paper exactly in front of me, so I'm about to pull this out now. I'm sorry for that. The first thing, of course, which we had said was, which I just mentioned now, is that people with disabilities are, you'll see I'm typing, are named as a priority group. We think that it's extremely important that all information about the COVID-19 vaccination, about the vaccination program, is fully inclusive and accessible, so that people with disabilities can fully understand what is the vaccination, how will the process be. So we asked as well that sites where vaccinations are delivered are made physically accessible, so that it's actually possible to reach them, because we know that there will be some facilities made for vaccination points, and that there would be live guidance and assistance provided for those who need it. One thing that we noted from the European Commission position, which is very positive, is that the vaccine should be considered a global public good and should be available free of charge. This was their recommendation for Europe. But there are other costs related as well that we would like to see, for example, free or low cost targeted programs for transportation if people have to get themselves to a place to have a vaccination. We also think that it would be very important to have specific outreach conducted to ensure that people with disabilities know the availability of vaccinations, and that all information campaigns are inclusive and accessible. The information systems related to vaccination, we think, should be disaggregated by age, sex, and disability, to make sure that, we've seen this, for example, in the collection of data about infection rates. This information has not, in most cases, been disaggregated. So we would like governments to be able to demonstrate as well afterwards how many people with disabilities were actually benefited from the vaccination programs, and to identify then in this way where there would be gaps. And that if there's information provided online, for example, that this is also provided in accessible format, so that people can really fully read and understand and access the information, but also that private life and confidentiality is fully respected there. I mentioned already the importance of receiving the vaccination being based on free and informed consent of persons with disabilities, the autonomy and legal capacity of all people. We know that many people with disabilities have been victims of forced and coercive treatment in many healthcare settings, and that this still goes on to today, and vaccination should not be done in this kind of manner. We believe that international organizations and government must ensure that persons with disabilities and their organizations meaningfully participate in the policy making. So it would be important for those public health services which are planning vaccination rollout, that they discuss directly with organizations of persons with disabilities and support services of persons with disabilities, to make sure that they know exactly, where the people are, how to reach them, how to communicate with them, and how to ensure that they have this access. And we also think that, in general, here is another area where organizations of persons with disabilities should be fully resourced to become partners in the rollout of information campaigns, to make sure that the most marginalized people are included, and that the messages produced in the information campaigns are clear, inclusive, and accessible. We know that it was already recognized, in fact, that by the European Commission in its strategy, that the overall communication of the vaccination program will be challenging. In many countries, you have already a lot of doubts from people about vaccination in general, and then vaccination, the same people who are concerned about vaccination in general are concerned about a vaccination that has been produced so fast. So the information component to the public, transparent, honest, clear, and accessible information will be extremely important, and that information should be fully available also to persons with disabilities. Thanks, Elham. Did I miss anything?
Thank you so much. Yeah. Thank you very much. I just posted also the link to IDA COVID-19 webpage, which also has this paper just published. Of course, the format apparently has some still needs to be improved, but you can read the recommendations and access the full paper there, where we also provide some rationale for why we are asking this prioritization and things that we are asking in this paper. So feel free to use that in your advocacy work. I think right now that many countries are like finalizing, adjusting, or like discussing their policies and programs around COVID-19 vaccination. It's a perfect timing for persons with disabilities, their organizations, and their like allies to advocate for this inclusion, because this is one thing. Yeah, go ahead. I think you want to.
I just thought of one more thing, Elham, that came from this morning. So we had a conference this morning here in Europe, the European Day of Persons with Disabilities, and we had one comment from a participant, which leads me to think of more work that we need to do. Is the representative from the European Deafblind Union asked if it's possible to have good practice sharing on how to ensure that people with disabilities are reached by vaccination programs, but also that it's done well for people with disabilities. She mentioned people with sensory disabilities, but I think this is kind of guidance should be created in general for public health services. So this is something our paper explains more from a policy point of view, what we think needs to be done. But I think there will be a need for the World Health Organization or other public health authorities to explain in more detail how to make sure that this is done correctly.
Yeah. For example, when we talk about obtaining free and informed consent,
Absolutely.
how exactly they should do that?
Absolutely.
Like what kind of information should be included in that information campaign that we were just discussing? Like, how they should communicate with the person when they arrive in the medical center, in the vaccination center. What do we mean when we say the vaccination center should be accessible? And of course, this good practice sharing is important. So if you have good examples from the ground, somebody successfully making this prioritization and accessibility and inclusion happening, if they can share those good examples, that would be extremely, extremely important and helpful. So yeah, feel free to post your questions. If you have any questions, comments, or suggestions, how you want to use this paper in your work, please feel free to post them on the website. I just want to use this time to also highlight another point where when we say that if we are not prioritized, we are not going to be included. What do we mean by that? Because in many, like if you look at the access to healthcare, you see that persons with disabilities are always among the last who are included. Like, for example, in accessing, just one example, sexual and reproductive health. So if we leave it to the society to decide on a natural, like in the way of its functioning, to when to provide these vaccinations to persons with disabilities, it is very likely that they're not going to be included in the first set. And you know that in many countries, the number of vaccines available would exceed, the number of people would exceed the number of vaccines available. So we have vaccine for 1/3 of the population, for example. So if we don't prioritize, if we don't specifically ask for persons with disabilities to be included, the result that we're going to see, the outcome that we're going to see will be that persons with disabilities are not really included. So we don't want to come back next year, say, oh, among like 30% of the population who received the vaccine, only like 1%, less than 1% were persons with disabilities. We don't want to come back with that. So today we want to request prioritization so that tomorrow we're not going to come back and say, no, we are not included. Again, we are left behind. So that's the message that we are trying to send in this paper, and hopefully together in campaigning in social media around that. Any final thoughts, Catherine?
Just as you've been talking, I've been thinking about how to do the next steps in terms of discussing how to give more guidance on how to make the vaccination rollout more inclusive and accessible. And I think that this is an area where we can learn from other, maybe there have been experience during other pandemics where there have been mass vaccinations, but that my reflection is more me writing notes for myself for what to do next. But thank you very much for bringing this up and also for working very fast to finalize the paper so quickly.
Thank you so much. We don't have anything in the chat box, do we?
No, we don't have.
Okay, thank you so much, Catherine, for joining me for this important conversation. I think it was just a start point.
Yep.
And hopefully we can have more and more opportunities to go through details and practicalities, next steps together.
Thanks very much, Elham. Bye-bye.
Thank you. Bye. Okay, so this is about COVID-19 vaccinations. So we need to move quickly to the next step, which is about inclusion of persons with disabilities in humanitarian action. Some of you, especially DPO colleagues or humanitarian colleagues, may have been part of the discussing and finalizing the IASC guidelines on inclusion of persons with disabilities in humanitarian action, which was launched last year, November, in New York. Now, so it's a bit older than 1 year. And today we are joined by Christine Lang from the UNICEF disability team, who will discuss with us what happened after the launch of the guidelines. What are we doing to make sure that persons with disabilities are included in the humanitarian action? So Kirsten, welcome to you. Thank you for taking the time to join us today. I know everybody's schedule is super packed these days with COSP and the International Day of Persons with Disabilities. So tell us what happened after the launch of the ES guidelines. What were the measures that were taken, and what are the opportunities that civil society can join and use? Go ahead, please.
Absolutely. No, thank you, Elham. And thank you so much for the opportunity to be here with you today. So as you mentioned, the guidelines were launched in New York in November last year, but we really very much saw the launch of the guidelines not as the end point, but very much as the starting point to the process to strengthening inclusion of persons with disabilities in humanitarian action. We also were very keen to make sure that we continue and really build on the momentum and the very good practice that had been established through the development of the guidelines, where we were bringing together organisations of persons with disabilities, UN entities and NGOs coming together to develop the guidelines. So with those two things in mind, we established the reference group on inclusion of persons with disabilities in humanitarian action, which is very much intended to support implementation of the guidelines, but also more broadly to support inclusion of persons with disabilities in humanitarian action. Now, what's particularly important about the reference group is that it, again, brings together organisations of persons with disabilities, UN entities, NGOs, and other humanitarian actors to really work jointly towards this agenda. Reflecting the diverse membership of the group, the reference group is co-chaired by the International Disability Alliance, by CBM Global, and also by UNICEF. So we've been working since about December last year, January this year, to establish the reference group. We currently have over 125 members, many of whom are organisations of persons with disabilities. We've recently finalised our work plan, which I'm very happy to talk through with you as well. And we see the group as a really important way to ensure that inclusion of persons with disabilities is considered throughout all of humanitarian action, both at a global level and at a country level. And our work plan very much reflects our work at those two different levels. So I'll probably stop there as a very brief introduction, but I'm happy to answer any follow-up questions around that.
Oh, sorry, I think I was muted.
Yeah, we hear you now.
Yeah, thank you so much, Kirsten. So I think people can still join the reference group, right?
That's correct. Yes, we very much encourage anybody to please join. The reference group is open to organisations of persons with disabilities, open to NGOs, open to academics, private sector. We very much want the group to be a forum where everybody is welcome and everybody is working together. But we particularly would like to encourage organisations of persons with disabilities to join. I will put in the chat box just after this conversation the link where people can join, and people can choose whether they want to be either an associate member or a core member. Basically, associate members can engage on an ad hoc basis on specific issues that might be of particular interest to them, whereas core members have more of a make more of a commitment that 10% of their time can be dedicated to engaging in the group. So whether you have capacity to engage more actively, or whether you perhaps don't have quite so much time, but you would still like to be engaged, we would in either case very much welcome your participation.
Can you give us a little bit more detail about what is the work plan of the group for future? What are some of the activities that the group will be engaging?
Sure. So the work plan has 3 main work streams, and it really reflects the different levels that we work on. So the first one is more at the country level, and the first work stream is very much focused on operationalizing the IASC guidelines and operationalizing other global frameworks for disability inclusive humanitarian action. So it's focusing on developing operational tools, it's focusing on capacity building of humanitarian actors, documentation of good practice in humanitarian action. So really working at that ground level to ensure that the commitments that have been made at a global level are translated in practice. The second work stream is really more focused at this global strategic level. So the second work stream is focused on inputting into global humanitarian processes to ensure that disability is reflected and ensure that disability is very much integrated throughout those processes. That work stream has a particular focus on IASC results group 2 on accountability and inclusion, which people may not be so familiar with, but happy to share more information on that. This results group is an interagency body under the IASC, which really works on accountability and inclusion. So we're working to make sure that everything coming out of that group is very much inclusive of persons with disabilities. Now, the third work stream is specifically focused on supporting engagement by organisations of persons with disabilities in humanitarian action. So both supporting engagement by organisations of persons with disabilities in other parts of our work plan, but also more broadly in humanitarian action. So developing some very specific mechanisms to support that engagement. So for example, developing some capacity building of OPDs to be able to become more familiar with the language of the humanitarian system and be able to engage as partners in humanitarian action. And also creating a space for OPDs and humanitarian actors to exchange and to jointly develop strategies to strengthen inclusive humanitarian action. In addition to those 3 work streams, which we're working on going forward in 2021, we also, during 2020, had 1 work stream on COVID-19. And so under that work stream, we developed some key messages on how to apply the IASC guidelines in the COVID-19 response. Those key messages were endorsed by the IASC and were circulated quite widely. So that was the first real concrete output from the reference group. Back to you, Elham.
Thank you very much, Kirsten. I was about to ask about the group engagement in COVID-19. So we discussed a little bit about DPO engagement. I wanted also to highlight that, this is a very important priority for us to ensure the principle of nothing about us without us is also being implemented in the reference group in the humanitarian work. And you discussed some of the measures taken or we are planning to take actually in terms of capacity building and but at the same time we all recognize that the humanitarian work has its own specific challenges. So it would be a kind of a mutual work together, like a work of DPOs plus the reference group to make sure that we are meaningfully participating as DPOs in the work of the reference group. So I want to ask a very kind of maybe more specific question about at a field level, like country level. You discussed about the work stream 1, but I want to see like how we can make the change on the ground in terms of inclusion of persons with disabilities in humanitarian action. We do have the guidelines, we do have the other normative frameworks, but not necessarily just from the reference group point of view, but also from your own experience. I know you have been working on disability inclusion a lot, for example, with UNHCR in your previous role. So if you're about to say, like, what are the key things that we can do to make sure that the change is really happening on the ground, what you would say for that? And thank you for I'm sorry if the question is a little bit like maybe just coming this way, but I'm really want to hear from you based on your expertise on what would you see as the things that would change the situation on the ground.
Okay. It's a really good question, Elham, and it's a huge question. I think we could probably spend this whole session just speaking on this. So I'll try very hard to pick up on the key points that I would mention. I think the first point would be on ensuring that we have operational tools. Like, the guidelines are an incredibly useful resource, but they're very much a reference document. What we need to complement the guidelines is really those operational tools that people implementing on the ground can use in the context of an emergency, where they perhaps don't have the time to go through the full guidelines in detail. So, for example, having checklists for WASH actors, having very simple needs assessment tools for protection actors, for example. So one of the things I think is really having those operational tools, both as standalone tools, but also ensuring that disability is very much reflected in the operational tools used by the sectors. That would be the first. The second, and I think most fundamental shift needed, is engagement of OPDs at a country level. We've seen very strong engagement by OPDs at a global level and a regional level in the ISC guidelines development process. And I think we now need to really be giving a lot of support at the country level for OPDs to be able to really engage directly in humanitarian action. And I think for that to happen, there's a few different things that need to happen. Firstly, it's often an issue of resources. You know, OPDs, particularly at country level, do need resources to be able to engage in a meaningful way in humanitarian action. And we know that in many senses, the humanitarian financing mechanisms are not so inclusive. So I think that's one thing we need to be working on. Also, just creating the space for humanitarian actors and OPDs at the country level to engage, to understand each other's mandate, to find ways to partner in a meaningful way, and just creating that space. We often find that humanitarian actors at country level perhaps don't know who are the OPDs in the area where they're working, or OPDs in that area may not be in contact with the humanitarian actors. So really creating those connections, I think, is key. I think capacity building, we've already mentioned it, but capacity building of those frontline humanitarian actors. I feel we've come a very long way in terms of, at the global level, in terms of advocacy. Now there's a very clear recognition that more needs to be done to strengthen inclusion of people with disabilities in humanitarian action, both in terms of receiving assistance, but also in terms of participating in the response itself. What we've perhaps had a little bit less focus on is that capacity building at country level to ensure that frontline humanitarian workers are equipped with the skills and knowledge. And that includes the knowledge of who are local OPDs, how can you engage with local OPDs, how do we ensure accessibility of assistance, etc. So that capacity building from the humanitarian actor side. And I think one other point that I'll mention, because I realize I've probably spoken a bit much on this, but one other point would be that I think also supporting OPDs to be able to engage with people directly affected by humanitarian emergencies. And what I mean by this is, for example, in a refugee situation where people have been displaced from another country and they've come across the border, the OPDs present in the place where those refugees are being hosted can have an incredibly important role in the humanitarian response. However, I think we need to be providing more support to ensure that refugees who are affected by the conflict themselves can also be participating in those OPDs and addressing some of the challenges around that. Sorry, Elham, that wasn't quite as clear as what I would have liked to be. But
No,
I hope it goes some way.
no, it was actually very helpful to think about. I mean, it's very helpful to think about it. And as you mentioned, there's a long list of things that can be done. I, in particular, for example, myself want to emphasize on attitudinal barriers that actually hinder real inclusion. So like it can be like very much achieved through the capacity building, especially, for example, what we have been planning to do in the Bridge Article 11 trainings, which brings together humanitarians and persons with disabilities and DPOs under the same roof, and by working together, interacting during the capacity building activities, these kind of barriers hopefully will be decreased, because when people start to see persons with disabilities as active participants, decision makers who can take responsibilities and contribute, as you just mentioned, that's the deal breaker. That's what we're gonna change, make the change on the ground happen. Like what you just said about refugees themselves. Like we have refugee-led organizations, for example, organizations that are made by refugees for refugees to convey the messages and make sure that their voices is reaching to decision makers. If these refugee-led organizations have persons with disabilities on board as decision makers, not just on issues on disability, but also on anything relevant to the situation of refugees in this particular example, then we can see the change is coming in a natural, strong way, because the views of persons with disabilities are being heard. And also, I also wanted to highlight like inclusion and accessibility being taken into consideration from the planning stage, from the procurement stage, not just as a kind of afterthought. This is very important because sometimes for example, again, very classical example of camp management. The camp is established, the management is in place, and then they start thinking about, okay, how disability inclusive that is. So maybe it's a bit late. If it's considered from the planning stage, of course, that would be more like efficient and change bringing. So thank you so much. Any final thoughts? Anything that you wanted to highlight as a final message?
No, I think just to very much support what you just said, Elham. I couldn't agree more on the point that you made on attitudinal barriers. I mean, currently, in many cases, we see that people with disabilities are purely addressed through a vulnerability lens in humanitarian action. And for there to be real change, people with disabilities do need to be seen by humanitarian actors as actors in the response themselves. So just to very strongly support what you said on that. And also on addressing inclusion from the planning stage. And I would go even further back than that and say that inclusion of persons with disabilities needs to be addressed from the preparedness stage. Mm-hmm. If it's addressed from the preparedness stage, it's more likely to be something that is then reflected in the planning, in the design, in the implementation of the humanitarian.
I think we are quite successful on that in the humanitarian needs overview and humanitarian response plan. We are moving forward on that as well, right?
Yes.
We have a group who are working, and they have established a guidance on inclusion of persons with disabilities in humanitarian response plan, which is on the planning stage, and they are actively working to ensure that persons with disabilities are included in the needs assessment and planning stage. And Kirsten is again an active member of that group as well. So thank you so much for all you do for inclusion of persons with disabilities. Please don't forget to post the link to the DRG page in the chat box. And thank you again for joining me today.
Great. Thank you very much, Elham, and everyone.
Yeah, thank you. All right. So one last, but of course not the least, is what we hear about climate change these days. I don't think there is anyone here who has not heard about it. Like how we need to save our planet. We need to combat the climate change, which is changing our lives. And if we don't act on it quickly and efficiently, it's unfortunately going to be late. So this is quite serious, as we all know. And the question is that what we should do as persons with disabilities and organizations of persons with disabilities to play a role, to make sure that we are included in any measures that are planned, and to also make sure that our role is defined and we are here to play our role. So for that conversation, I have invited Mary Kyouk from the CBM Global. Mary has done quite a lot on bringing up and highlighting this important topic. Of course, the topic of disability inclusive climate action is quite new, and we are just starting to be active on that. It's not very old, not as old as other topics, but we have been quick and we have been pretty active in this regard, and we are planning to be more active. So that's why I have invited Mary to come join me today to discuss some of the current status and some of the measures that we can take. Welcome, Mary. Thank you so much for taking the time. I know you're also super busy these days, so really appreciate your time.
Thanks, Elham. Thank you. Glad to be here.
Okay, so Mary, tell us about inclusion of persons with, when we talk about inclusion of persons with disabilities in climate action, what are some of the examples of the impact of climate action on persons with disabilities, and if they have been documented so far, where and how? Thank you.
Okay, thanks, Elham. I might just speak broadly because I know we have a short time as well. First of all, just to speak to a piece of research that we did within CBM Global towards the end of last year, which really looked at OPD involvement in climate action and justice, and really kind of was very small scale research, but the key aim of it was to start getting voices and visibility on the issue. There's been lots of, I would say lots, there's been a lot of research done, you know, from a literature review point of view around kind of climate and disability from different perspectives. But the voice of OPDs and the voice of people who are being impacted by climate was something we were eager to tease out. So within that research, and I'll post a link to the research, you know, we found and heard from OPDs that were, you know, involved in climate justice and climate action at a national and a local level. So when we think of, you know, your point there about it's a new topic, it's a new area we have to engage in, I think the first point we found was that actually OPDs are engaging in climate action and are engaging around the area of climate justice. So this is really positive. But there was also highlights about how, you know, capacity building was needed, education and awareness around, you know, kind of the key concepts that are used. Because again, it's, we think of it at a global level and at a national level, there's a lot of different terminologies and words that we're all ourselves coming to terms with and understanding what it means from a climate perspective, and that this is also the case for OPDs and all different groups that are involved in it. So this was kind of a key thing that we found, and obviously very kind of interested to work with. CBM Global isn't an OPD, but works and supports and partners with OPDs in work around advocacy. So when we talk about how we define the agenda, we're very keen to work alongside the OPD movement with this. We understand that, you know, the values and the transformative agenda that needs to come forward has to be driven by OPDs, but very supportive in terms of how to work around that. So I suppose just kind of when we talk about why, one of the key questions that coming up was, why is disability a climate issue? I suppose just broadly speak, you know, there's three key issues. I mean, first of all, it's an issue of justice fundamentally. And we know that over recent years, there's been growing recognition that the impacts of climate impacts those who are living at the intersection of poverty. And when that is intersected with disability and gender, it becomes much greater in terms of its impact. And this has kind of been highlighted this year, which has been great to see by the OHCHR in their study. And also we've seen it highlighted as well by the Intergovernmental Panel on Climate Change, which do their annual reports. So I think it's beginning to be seen as a key issue and an issue of justice, and persons with disabilities and OPDs need to be central to that. Secondly, it's an issue of state obligations. The whole process around climate adaptation, mitigation, and the whole aspect of how the UN framework for climate change moves forward really needs to be inclusive of persons with disabilities. We know this from Article 4 of the CRPD, pushing for ensuring that representative organisations and persons with disabilities are included in consultations, and this is really critical also for anything to do with climate change policy development. And then we also know from the movement in terms of it's people-led community solutions that's leading a lot of the change around climate and responding to it. So the whole aspect of persons with disabilities and the skills that can be brought to this from the disability community, because research has shown that the disability community is not included in any type of responses or involved or engaged with. So I think this is a really critical area. So I might just stop there for a minute, Elham, but they were kind of the key, I suppose, whirlwind tour of some of the issues, but not all of them, obviously.
Yeah, thank you so much, Mary. Very nice introduction and very nice journey quickly to what is going on. So I just wanted to, for example, mention that, and I want to also hear from you, what has been done so far in terms of inclusion of persons with disabilities in climate action? We know that there have been, we have the United Nations framework on the Convention Framework on Climate Change. We have each year, we have the Conference of Parties to the Convention, and there are so many things going on around the world in terms of climate change adaptation. What has been done so far in terms of inclusion of persons with disabilities in all these activities, documents, and negotiations, and both in terms of like global processes and also at national and regional and maybe local levels. As far as we know, I know that not all of that has been properly maybe documented, because, for example, I just want to give an example. One conversation we had was that, for example, many DPOs are working on climate without even knowing that. Yep. So one example is that when you are advocating for access to public transportations for persons with disabilities in your city, you're actually a climate activist, because you're advocating for something which is more environment friendly and would contribute in the reduction of carbon, right? So what is the situation? What has been done so far? Where are we?
Okay, well, Elham, I'll try and answer that question in a comprehensive enough way as I can. I think there's a number of things, you said yourself there that, you're looking, OPDs are involved and not necessarily always thinking it is actually climate, but it's actually something more broader related to climate. And I think, we saw some of that, in the small piece of research that we did. But I think we need to start making the connections between, the new urban agenda, all of the various different processes that have been going on in terms of the global level, about how to bring visibility, because I think, there's good practices and there's examples at country level. There isn't really a collective around what this looks like and what a kind of a movement looks like that from a global bird's eye perspective. So I think that's something that needs to be done. I think we're really at the very early stages you've mentioned the climate processes. One of the key things, really needs to be looked at is how visibility is brought to these processes around climate, around persons with disabilities. A lot of the narratives beforehand have been very much related to kind of health and the impact of climate change on people's health, but actually we need to look at, how to start changing that narrative also to talk about, you know, the discrimination that people with disabilities continue to face, the intersection and the impact of climate on person's lives, and actually telling that story. So much similar to what happened with gender. I mean, gender wasn't initially on the climate change agenda many years ago, and now it's a critical voice there. So I think bringing something like that is something from an OPD perspective is really critical, because, you know, it's something that's been achieved by the international disability movement for many years, influencing into international processes. We've seen it with Agenda 2030, seen it with Sendai Framework. So bringing that collective approach again, and the knowledge and the experience that organizations have, I think is something that is critical. So I don't know whether that's actually answered your question, Ellen. I'd probably give it an action more than an answer. But yeah, so I think, yeah.
I may just want to add on that, and thank you so much for that. Just wanted to add that, for example, at global processes in terms of the decisions by the Conference of Parties, we have had mentions of disabilities, but that has been more on a vulnerable groups, among the vulnerable groups and so on, but no mention or no reference of persons with disabilities as participants, as decision makers, as role players. So that's what we are hoping to change. So can you tell us a little bit, Mary, about what's happening next year, for example, around COP26 and so on, and what are some of the things that you think, I mean, we are, all of us together have joined together with some other actors, and what are some of the plans that we have in the pipeline, as far as you can share, to be more active in this regard? And of course, what suggestions, like, for example, we have civil society colleagues in this call, what they can do in terms of documenting, in terms of advocacy and other measures.
Yeah, so maybe just to speak about actually the global and regional, I might just speak briefly too. So the process next year is COP in Glasgow, which will take place next November. I'm looking at trying to get a delegation of OPDs to COP to have at least a visibility raised with this. I think it'd be one of the first times that this would be done. So that's something that we're all kind of discussing at the moment. Also, secondly, I think, you know, kind of more long term is actually looking at, you know, the possibility of a constituency group to the UN FCC process for persons with disabilities, and then looking further again in terms of, you know, how to put together a roadmap for national inclusive action plans, kind of similar to what is being done for gender. So I think that's kind of the thinking of it, and it's a small group kind of thinking at the moment. So looking obviously for more people to join, and there's a lot of different organizations working around climate justice as well at the moment. You've got the OSF survey, which is out for out at the moment, and encourage everybody to apply to that. So there's a huge amount of activity. So really looking at how we can connect the dots on that. I think just to speak to the regional level, just really briefly, and I know we have EDF here also. You know, you spoke there about accessibility being a key thing from a transportation perspective. I mean, the European Union just adopted the Green Deal this year, which has within it, you know, a significant amount of funding. And one of its objectives is looking at how to have you know, clean, efficient and safe transport. Like, that is a really key place where you could do advocacy around inclusion, to make sure that the funds that fund all of that work going forward becomes inclusive and is held to account. So that's kind of just an idea. But I think, you know, bringing together a number of people to brainstorm more and pull together a strategy is something that is needed, and we're very happy to support with that.
Yeah, thank you very much. So if your organization is not already working in climate action and you're interested, please get in touch with Mary, with myself, and we will be happy to join you in what we are doing together. Hopefully we're going to meet some of you next year in Glasgow around the Conference of Parties to the UNFCCC. And like, I think what can make the change here is a coalition of persons with disabilities and their organizations, the climate organizations or the civil society organizations who are working in terms of in the area of climate action, and governments. So if three of us working together, I think we can make that change. I see we have Maria Ket with us, who is working on the survey that Open Society Foundation has launched about activities in climate action. So please feel free to post the link here so colleagues can, if they're interested, they can also join that. Any final messages before? I know that there is another breakout session is right after this one, so I want to give the colleagues the time to join that one. So if any final messages, please go ahead.
I guess just one final message from the climate perspective is that, you know, we're always arguing and coming in at the end as an add-on in all of our advocacy work, whether OPDs or whether we're advocating for disability inclusion as an INGO. This would be really important now to actually to really critically get engaged and involved so that it becomes part of the climate process going forward. Yeah, it's just from my side.
Thank you so much. Thank you so much, Mary. I don't think we have some very interesting and encouraging comments and contributions in the chat box, which I really appreciate, but I don't think we have any questions. So please adjust your modes on living in the urgent mode situation. And I think it's difficult, but at the same time, we can play significant and efficient roles together. So thank you so much for joining us in this session today. And look forward to continue working with you in one of these areas or other areas that we didn't get a chance to discuss today. I also want to highlight that we have a session on implementation of the Security Council Resolution 2475, which is about the inclusion of persons with disabilities in armed conflict tomorrow morning at 8:30 a.m. New York, which is an interesting session discussing 1 year after adoption of that resolution. So I don't know if we can get the link to that to register for that. I think it's easy to find it in the list of side events. So look forward to seeing some of you who are interested in armed conflict and disability in that session as well. Thank you again. Thank you so much, the logistics team, for supporting. And thank you so much, Mary, Kirsten, and Catherine for joining me today. It was a very interesting session together.
Thanks very much, Elham.
Thank you.
Thanks, Elham.
Bye-bye.
Bye.